In the more distant future, there'll be other medicines with different mechanisms of action as well. An example of one of these is development by a company called Kodiak called antibody binding complex, or ABCs. ABCs are very big molecules that stay in the eye for a while, but have shown in early phase studies that the duration of action may be as long as 6 months between injections. This is very nice because you potentially get 6 months of therapy without having to insert a device in the operating room. Another therapy that people are working on in the horizon is gene therapy. There are two companies. One is REGENXBIO, in which a gene vector is placed under the retina in the operating room. And this gene therapy works by making ranibizumab in the eye. It's like a ranibizumab type factory. This trial was performed on people who had hard to treat lesions and needed significant injections to control their swelling. And the therapy allowed them to remain dry in their OCT with few or no injections. The other medicine in gene therapy space is called Adverum. It mimics Eylea, or it's like an Eylea factory, a aflibercept factory. It's given by injection in the eye, so no operating room is required. Similar to REGENXBIO, the Adverum gene therapy decreased the number of extra injections needed to stabilize patients with high-need wet AMD. Both of these therapies have promise, but each has its drawbacks. REGENXBIO requires surgery in the operating room, and currently Adverum's therapy is associated with intraocular inflammation. In terms of dry macular degeneration, there are some new therapies in development. Currently, if you have dry macular degeneration, there's not much we can do. You can take vitamins, get good UV protection, have a diet in green leafy vegetables, control your blood pressure, don't smoke, but that's pretty much it. So right now, therapy is kind of focused on lifestyle changes. But there are a number of companies working on medication that basically attack these molecules in the inflammatory cascade or complement cascade. Some of these are in clinical trials. One is called Apellis, which is doing a phase 3 trial that is fully enrolled. And the goal of the Apellis medicine is to slow the growth of dry macular degeneration over time. Another company called Iveric Bio was also working on a therapy with similar mechanisms of action. Similar to the therapies of wet macular degeneration, these medicines do require injections in the eye, but they work by slowing the natural history of the disease. So the vision gets worse more slowly, but doesn't get better. This is not a reversal. It's basically a preservation over time. These two studies probably will have results in the next 2 to 3 years. But the goal of all these therapies is to preserve patients, allowing them to remain independent longer.